So after a hair transplant, the hair regrowth is quite an important thing for patients to be aware of. Hair transplant technique has come a long way from years ago, and the art of hair transplant has been perfected so that the hair growth will look very natural. But often patients don't know about the process from the beginning of the surgery to when they can have hair. It's really important to know that the hairs have to come from you. Otherwise, they get rejected if they're from another person. And once they're transplanted, they need specialized aftercare with how they need to be looked after for the first few weeks, how they need to be shampooed, and with what shampoo and conditioner. That being said, the important thing is that the hairs that have been replaced as little stubbles will be in place for about 2 to 6 weeks. After 2 to 6 weeks, the hairs go through a period of shock where the hairs will start to fall out. At this point, the patient may be very concerned that they've spent a lot of money, a lot of time, and all the hairs are falling through. This happens in everybody and is part of the hair transplant process. The hair roots are still in place, embedded in the tissue. And despite the hair falling out, the hairs will remain alive. And generally, it takes about 3 to 4 months for the hairs to start to bud through. And essentially, over the next year to 18 months, the hairs will come out through one by one at different rates. And it's not until a year to 18 months until the process of hair transplantation is complete. Those hairs will remain in place as long as the patient's alive. But sometimes the patient's existing hairs can get depleted over the years, and they may require further hair transplant to thicken the growth of the hair that they've lost over the years.